Hello and welcome to today's webinar, Unlocking the Potential of STI Testing in Urgent Care, Business, Population Health, and Clinical Perspectives. My name is Samantha Burke. I am NARUCA's Administrative Director. Now, for those of you who don't know, NARUCA is in its 12th year of existence, and today, NARUCA provides grassroots local representation in partnership with UCA's National Strength. We integrate urgent care medicine into broader public health initiatives, and we provide education and advocacy for urgent care medicine in the Northeast region. Now, lastly, I would like to thank our platinum sponsors for their continuing support, HealthTrack RX. And with that, it is my distinct pleasure to introduce you to Ben Fabre.
Thank you, Samantha. No matter your role in urgent care, today's webinar has something for you. Here's why. Today, we're going to discuss the clinical, operational, and financial challenges and opportunities regarding treatment, a special patient type, patients with sexually transmitted infections, unlocking the potential for STI testing in urgent care. Now, I'm going to set the bar high for our panel today. We have three experts who really know the clinical, operational, and financial side of this business. And I'm asking them to deliver four things for us. One is we want to understand the strategic opportunity to differentiate and become a top performing urgent care center when providing care for patients with STI infections. Second is understand the population health impact that you can have on your patient community in your own local area. Third thing is the clinical insights at the bedside. What does it take to deal with and treat these patients? And ultimately, it's about getting patients healthier faster. My name is Ben Fabre. I'll be your host for today's session. Now let me introduce our experts. We begin with Alan Ayers. Alan's the president of Urgent Care Consultants. Alan, you've published extensively on improving urgent care operations and efficiency. Thank you for joining us today.
Thank you.
Next, we have Dr. Stephen Goldberg. Dr. Goldberg is the Chief Medical Officer of HealthTrack RX, and more importantly, is an emergency room physician and an urgent care physician with the University of Louisville Health and really understands what it's like at the front lines treating these patients. Dr. Goldberg, how are you?
Awesome, Ben. Excited about today's topic.
I'm excited to hear what you have to say from a population health perspective as well. Ali Brigo is the Medical Science Liaison for HealthTrack RX. She's also a physician assistant with Modern Pediatrics. Ali, really excited to hear your perspectives on dealing with these patients on the front lines.
Yeah, thanks, Ben. Excited to be here.
Thank you all. Quick conflict of interest statement. The opinions expressed by Dr. Goldberg and Ali are solely from their individual clinical perspective, and the material information presented here is for general information purposes only. With that, Alan, the stage is yours. Walk us through the business perspectives of urgent care related to sexually transmitted infection patient care.
Yeah, certainly. Thank you, Ben. A little bit more about myself. When I first got into urgent care 20 years ago, there were only about 1,200 centers. Today, that number is closer to 15,000. So I've not only seen, but I've participated in the entire life cycle of the urgent care industry. I've been a CEO, COO for 8 years, served the board of directors of the National Association, UCA, which was mentioned. And then, as Ben mentioned, I'm also a senior editor of the Journal of Urgent Care. So I've written a couple hundred articles on the subject. I always like to level set with the basic economics of urgent care. Urgent care is a business, and everything kind of comes back to how does urgent care make money? So in any business, your revenue is equal to volume times rate. How much did you sell times how much you sold it for? So if we think of retail, Walmart sells a lot for less. Saks Fifth Avenue sells less for a lot. Fortunately, in healthcare, our rates are set by third parties. So we don't have the ability to set our prices like most retailers. Now, you can collect on your full rate. That's really a different question. But because rate is somewhat stable or somewhat set by others, that means urgent care is a volume-driven business. We make money in urgent care by more feet through the door. The volume is the one lever that we really have to drive revenue in our business. I would also add that labor functions as a fixed cost. So in any business, you have variable costs. The variable cost is the cost attached to each additional unit. In our case, that would be the cost attached per patient. But you have fixed costs, which are the costs to open the doors in the morning before you see a single patient. Because urgent care typically starts starts and finishes with one team working in the center. So your nurse practitioner, your medical assistants, your x-ray tech, your front desk, because you have a set skeletal crew, first thing when you open in 12 hours until you close later, labor really functions as a fixed cost in urgent care. So that means urgent care has a lot more in common economically with a high fixed cost business. So an example of high fixed cost business would be like a hotel. It would be an airline. We're typically talking in those instances of high fixed capital cost. But again, labor as a fixed cost creates the same economic situation. And so that means that one, in order to maximize productivity of our staff, our KPI becomes patients per hour per provider. So we're not only driving volume, but as we drive volume, volume leverages the fixed cost of our provider. And then when we compare again to other types of businesses, say for instance, an airline sells a perishable product, meaning that as soon as the plane backs up from the gate, the ability to sell that empty seat is forever lost. I would say urgent care, we really need to have the same mindset that if a provider can see 4 patients an hour, but they only saw 2 patients an hour, as soon as the clock rolls over 12, the ability to see those 2 additional patients per hour is forever lost. So to that point, I would say that the average urgent care is operating at about 58% capacity with surplus capacity of 43%. I would say the biggest loss in urgent care is this loss due to surplus capacity. And so again, to create a visual image, this would be like the plane taking off with 48% of the seats empty. It would be like the hotel renting out 58% of the rooms while 43% of the rooms sit empty. We have unutilized provider capacity of 1.7 patients per hour on average. So given this situation of excess capacity in urgent care, this chart here shows how urgent care profitability is volume driven. So again, looking at our green line here in the middle, when we open first thing in the morning, this center is incurring just shy of maybe $3,000 in staffing expense that day. That expense is sunk cost, staffing, rent, utilities, marketing, all the costs that are incurred the moment you open the door, whether you see 1 patient or 5 or 500 patients. The point is, then as you see patients come through the door, which would be our orange line, every new patient that walks through the door starts chipping away at that fixed cost. In this model, I'm using $135 as the net revenue per visit. So in $135 increments, we're chipping away at that fixed cost until we see the intersecting line in the middle at about 24 patients a day, where the center is breaking even. Now, if you have a higher net revenue per visit, if you run a more lean operation, that number of visits per day to break even can be as low as 18. I've heard it as low as 12, but that number is really going to be a function of what your costs are and what your revenue per patient is. So the economics of urgent care and why additional visits are important, and again, why we are considered a volume-driven business, is once you hit that break-even volume, every visit through the door, chipping away at those costs until you break even, then almost entirely every additional visit flows through to your bottom line. It flows to profitability. And so what we see here on the pink or purple line is that going from 0% margin all the way up to, if the center were to achieve about 50 visits a day, you would be hitting an EBITDA margin in the 50%. That's assuming once you get to about 50 patients a day, you have to add another provider and the chart kind of resets. We're not going to get into that minutiae here. But really the point is each additional visit is almost pure profit for the urgent care. So this is really why we would say urgent care is volume driven.
Great benchmarking data. I really love that perspective. The analogy of the airplane in a hotel, it puts things in perspective, is like, we got to get people through the door is really what rings the cash register the most.
Yes, most certainly. And if we're looking at about $135 revenue per visit, the variable cost per visit can be around $12, $15. So that means almost every additional visit once you break even, about 90% of that is profit. Again, key is volume. A center that sees 35 visits is going to be far more profitable than one that sees 25, and one that sees 45 visits is going to be exponentially more profitable. With that, key in urgent care is pushing volume through the door. Well, we also have a challenge in urgent care in that the business is very seasonal. And so right now, some clinic operators are scratching their heads saying with this mix of respiratory, influenza, strep, COVID, RSV going around, we don't need extra patients, but that's not true all year. And as I pointed out, the excess capacity is sitting idle over the year. Really, the key to driving additional profitability is driving additional visits. Well, to me, STI testing is a natural fit for this. And so when I look across STI testing, and I did a feature article in JUSM in the Journal of Urgent Care last fall. If you want to Google that, you can find some of these statistics outlined in more detail in the article. But when I sort from high to low, urgent care centers that are doing a lot of STI testing to those that are doing little to none, the findings are really remarkable. And as the chart on the left illustrates, 50% of urgent cares are doing essentially no STI testing at all. If they're doing it, it's in a completely immaterial amount. The top 5%, it's about 3.8% of their visits. The top 10%, 2.8%. And then the top quartile, it's averaging 1.3% of their visits. So what we see here with the chart on the left is that urgent care is highly bifurcated. Those that are doing it and doing it well are doing it in fairly significant numbers, where we have half of urgent care not doing any at all. Then what I would say is looking at the chart on the right, again, sorting from high to low, when I look at the total volume of centers that are doing more STI testing, so the top 1% of centers in terms of their STI volume sees an average of 55 patients a day. The average urgent care is seeing around the 50th percentile between 29 and 36 visits a day. So we see centers that have focused on STI testing are not only seeing the volume from the STI testing, and for those top performers at 6% of their visits or about 3.3 incremental visits per day. And remember what we said about incremental visits per day. Overall, these centers are on average busier. I would say that STI testing clearly is a part of that 55 visits per day, but if you do the math, it's not driven entirely by STI testing. To me, this would indicate that those centers that are doing more STI testing are executing well on all aspects of their business and therefore seeing more visits per day than those that are doing very little to no STI testing and therefore seeing far fewer patients a day. So it really goes to establishing yourself as the go-to place for test and treat, which urgent care very successfully branded itself during the pandemic is if you need a test and you need a script, urgent care is where you go. Not only if you are not doing any material volume of STI testing that you're missing out, but others are marketing to your patients. So I thought the billboard on the right, these are transit ads. They're at the bike rental ads. These were actually in downtown Columbus, and they were on several blocks. So I thought this was a little humorous for a couple reasons. One, it shows that the demographics of STIs are changing. You know, there's this silver tsunami, and that STIs can occur at any age. It's not a phenomenon among exclusively young people. It's not a phenomenon exclusively among certain segments of the population, but it is something that affects the population in general. So showing STIs are timeless here in the couple, that's just a reminder to get tested. While there are others in the community that are marketing STI, their position is test and treat. Why isn't this part of our test and treat menu? So that's a question that I would ask yourself. The chart on the left shows the age ranges that are tested in urgent care, the STI presentations by age. And although, again, it does skew younger, which I would say the younger population is probably more sexually active, you do see that it kind of spans age ranges and both male and female as well. So given the clear reasons why, if urgent care is test and treat, we should be be doing STI testing, then the question is, why aren't we? The common objections that I hear, first of all, goes to payment. I would say there are two distinct workflows for payment for STI testing in urgent care. If it is a medical visit, and if the testing is part of the medical visit, it could be to differentiate, and we have clinicians that I'll let speak to the clinical presentations in a little more detail, but say if the patient feels some sensation of pain, is it a UTI? Is it an STI? Is it something else? STI testing is a diagnostic tool for a presenting medical complaint. So the patient tangibly has a medical issue that they're presenting with, that's billed to insurance. And with that, the STI testing would likewise be billed to insurance. Then there are also patients who just want to know. They're asymptomatic. Maybe they were exposed. Maybe they had a friend. Maybe they, for their own reasons, want to know. Maybe they're going into a relationship, whatever those reasons are. And Allie will highlight some different personas in her presentation. There are people that just want to know. That is typically not covered by insurance and would be a cash pay service. And there are some really great examples out there. If you Google of urgent cares that have an all-inclusive testing package, would be paid cash at time of service. Other reasons why many urgent cares forego testing is presumptive treatment. Patients often don't return for results. The examinations compared to a basic head chest examination can be time consuming due to the sensitive nature. Chaperone is recommended for the exam. Some providers shy away from difficult discussions like partner notification, post-exposure prophylactics, public health reporting, and then some look at this and say, we don't need to offer this service because it's available at the health department, it's available at family planning or HIV agencies. Well, if patients wanted to go to those resources, they would go to those resources. We want to establish ourselves as the provider of first resort for urgent care. The last point I want to make is driving patient satisfaction. I did look for a correlation between STI testing and Net Promoter Score. It was very weak, and I think there are a number of variables that drive patient satisfaction in urgent care that it was really kind of hard to isolate, are patients who receive STI testing more satisfied than those that do not? And it may also go to factors that those that are doing STI testing are executing better on all aspects of their business, which would result in a higher score. So while I could not isolate that, I do have a JUSM article coming out next month that talks about the drivers of Net Promoter or patient satisfaction in urgent care. And in effect, it comes to get in and out of the center quickly, with lab results in hand, with a prescription written, and for the staff, without rudeness. So we see that some of these are really more negatively correlated. So short visit duration, in and out quickly, lab results in hand is probably less influential than not having a lab result or not being turned away somewhere else for a lab, not receiving a script, maybe because that information was available, or probably more important than the staff, there's an expectation the staff's going to be polite. I'd say the bar is somewhat low, but if the staff is rude or perceived as rude or snippy or doesn't listen to the patient, those are things that take away from that. So with that, we already talked about urgent care being the provider of first resort, and certainly as a convenient neighborhood next to Starbucks, next to Chipotle, after hours, weekend accessible, one-stop shop for testing, diagnosis, and treatment. This is something I believe patients fully expect to be available in urgent care. And if you're not offering STI testing, I believe you're probably selling your patient population short.
Alan, fabulous job. Very compelling data from both a business and a patient satisfaction perspective. Dr. G, I want to turn it over to you. Let's talk about STI testing from a population health perspective. What have we learned and what should we be expecting in the future?
Well, thanks, Ben. What we've learned is there is a huge burden of sexually transmitted disease. What we see for the opportunity is to get people engaged and treated and stop the long-term sequela of untreated sexually transmitted disease. I'll talk about 5 key, if you will, population health topics. What's the burden in the US of STD? how do we think about segmenting populations who might have STDs and particular needs. Third, we'll talk about women in particular. Because of their anatomy, they're at risk for particular long-term sequelae that's very concerning. Fourth, we'll talk about barriers to care. And it's because of those barriers to care that urgent care can be a great solution to help address this problem. And finally, we'll show at a population level, if you engage STDs, you reduce that long-term sequela. So it's a win-win-win. So first, the burden of sexually transmitted disease. We wanted to present CDC data, and this shows, based on reportable information, that we're having over 2 million reported infections per year, with chlamydia and gonorrhea, two of the most common reported infections. Now, there are multiple different infection types not represented here. There are others that require reporting, not represented here, but chlamydia and gonorrhea are most dominant. That said, the CDC overall estimates that about 1 in 5 in the United States could have a sexually transmitted disease at any time. So these numbers, frankly, are likely underreported. Some of that might be reporting barriers, some of it might be legacy from the pandemic, but the overall point is sexually transmitted disease infection is really quite broad. And what we mean, certainly, about a sexually transmitted disease infection is that it's a pathogen. It's a bacteria, it's a virus, it's a parasite spread between two people through sexual contact. When we think about the burden of sexually transmitted disease, like other issues, we want to think about particular segments of the population and what particular sexually transmitted disease issues are they dealing with, and that will help us target our service strategy. So frankly, as we look across these 5 images, we have a common group, which is adolescents, and they can represent, frankly, almost 40% of cases of sexually transmitted disease occurs in those between ages of 15 and 24. A huge burden. In men who have male partners, they have a particular profile of challenges, which is a co-infection with, for example, HIV and syphilis. So we want to think about that issue. For Hispanic, Black, or African American individuals, they represent almost 32% of infection events, but only 12% of the population. So they're disproportionately underserved, disproportionately undertreated. Individuals who are Native Americans also have burdens of high risk of untreated syphilis, both primary and secondary. And as mentioned earlier, the left profile is the silver tsunami. About 11,000 people per day in the United States are becoming 65, many in second relationships. And so sexually transmitted disease is a more prominent consideration in that population. Particular concern about women and women who have sexual transmitted disease because what it can do to their anatomy. First of all, a big factor is that chlamydia infection, Neisseria gonorrhea infection, which are prominent reportable sexually transmitted disease, are often asymptomatic in people. And as a consequence of that, people can have the infection and inflammation going on without being aware of that. Very concerning. In terms of a population, sexually active women, 15 to 24, account for almost half of all new infections. And the untreated chlamydia and Neisseria gonorrhea can be devastating. It can cause chronic pelvic pain. It elevates the risk of ectopic pregnancy. There's higher risk of co-infection with HIV and also risks for infertility. We'll show later, though, that there's opportunity, that many of these conditions are treatable, curable, and when treating and curing, you stop that long-term sequela, which is very satisfying and a motivating reason for even discussing today's topic. Now, one of the reasons that we thought this conversation today would be appropriate about urgent care is the realization that all these different segments of individuals have barrier to accessing care for sexually transmitted disease. There's rising gynecologic wait times. 50% of the counties lack an OBGYN provider. There are fewer OBGYNs in training. There are barriers to primary care. And sadly, your economics can impact your access to care. So if you have Medicaid, you have longer wait times to get access to care. These are all barriers that urgent care can help relieve. Now, the good news, the motivating news for me as a clinician is that many sexually transmitted diseases are fully curable. And with curing them, you prevent that long-term sequela and the unintended consequences of untreated infections. So if you treat sexually transmitted disease, it's associated with a 30% decrease in hospitalization for PID. If you treat sexually transmitted disease, it's associated with a reduction in ectopic pregnancy. If you treat sexually transmitted disease, there's a significant reduction in pelvic inflammatory disease rate. And also that's found with treating other sexually transmitted disease, such as syphilis. So there's a good story here. What I would say is Alan talked about the opportunity for our urgent care colleagues to provide the service and the benefits economically and in terms of service by taking on these patients. I wanted to give an overview of the population health outcome. It's a huge burden, 1 in 5, lots of opportunity, able to make a difference if we get on it. And now Ali will take us into the exam room and how we actually approach these issues in the clinic.
Thank you, Dr. Goldberg. We can see the patients coming, right? I mean, and that's the real key to what Alan was talking about is you need patience. And I think every population, no matter where your urgent care center is, you can see where those patients can come from. Ali, I'm an urgent care owner. I'm buying into the business opportunity that Alan laid out. Dr. Goldberg made a compelling case that, okay, I can see the patient volume coming. What I'm concerned about is at the bedside, dealing with these patients, it's a different patient type and they have unique concerns. Walk us through that part of getting into this business. What's the personal part? Who are these patients? Help us understand who they are, how to treat them, and how we work with them.
Absolutely, Ben. The one thing we should take away from my part of the discussion is that there's a variety of diagnostic tools that urgent cares can utilize to diagnose STIs. And that's really important because speed matters. It matters for the provider, it matters for the patient. That ultimately may be the reason why they choose the urgent care space to seek care for STI testing to begin with. As we've already touched on earlier, we know it's crucial for clinicians to diagnose and treat STIs as early as possible to prevent complications. What I'm going to touch on are what are your actual options? What do they look like? What's available to capture and diagnose these STIs in the urgent care space? And then we'll look at a couple of patients presenting to urgent care for STI concerns. As you can see, there are a lot of different options available for STI testing, and there's benefits and drawbacks to each of them, and I'll go through that. So your first option is nucleic acid amplification test and PCR. So these are highly sensitive, highly specific, typically accept various specimen types. They do usually require some sort of laboratory infrastructure. They can have longer turnaround times compared to point of care test. On the other side of the coin, point of care test, they give you rapid results, pretty useful in settings with limited access to laboratory facilities. A drawback of some point of care tests is that they may have lower sensitivity and specificity compared to your laboratory-based PCR, and the scope of pathogens can be limited. A lot of these point of care tests are moderately complex instruments, which urgent care sometimes aren't equipped to operate. So something to keep in mind. Wet mount microscopy or your wet preps, typically inexpensive and rapid since it provides point of care results, but it can have lower sensitivity that's time sensitive and requires a skilled operator to use. Serology, definitely a crucial, essential in HIV and syphilis diagnosis, and it has the benefit of being able to detect past infections and screening your asymptomatic patients. But serology sometimes cannot detect active infections in the early stages, and it may require confirmatory testing 6 to 8 weeks later. And then you have your bacterial cultures. This allows for antimicrobial susceptible testing, but it does require specific transport conditions. It can be timely to process, and it can have a timely turnaround time. There are a few rapid antigen tests commercially available now for STI diagnosis. These provide quick results, kind of like point of care tests. They're easy to use, but they can have lower sensitivity and higher rates of false negatives. So now that we've looked at the options that are available for STI diagnostics, let's just do a dive into some patient profiles that we have for patients presenting to urgent cares for STI testing. So here we have Chelsea. She's a 20-year-old female attending college, and she's symptomatic with abnormal vaginal discharge after her first sexual encounter. She wants to be checked for everything bad, in her words, but also doesn't want her financial claim record. What diagnostics may a provider consider for Chelsea? She wants to get checked for everything bad, so more broad testing may be utilized. Some diagnostics that could be helpful for Chelsea is point of care or PCR test to check for chlamydia, gonorrhea, trichomonas, serology to expand to look for HIV and syphilis, perhaps hepatitis, maybe a wet prep to look for BV or yeast. HSV can also sometimes cause vaginal discharge, so a point of care test may not be the best option if we're looking for this virus. So PCR may be used if the provider wanted to test for this in particular. Let's think back to barriers to patients seeking STI testing in the first place. This patient could still be on her parents' insurance and maybe doesn't want her parents knowing that she is getting STI testing. There could also be some cost considerations in play as well, or urgent care could just be more accessible to her since she may be living somewhere different than where she grew up and she doesn't have quick access to her usual primary care providers. And now we're going to take a look at Mike. Mike is a 52-year-old, recently divorced male complaining of new onset of burning with urination, also has a new sexual partner in the last week. He's not so concerned he has an STI. It's on his radar, but he thinks he may have a UTI. But something to note is that Mike does not have an established PCP. As far as diagnostics, a provider may opt to do more targeted diagnostics for Mike. They may check a UA for signs of UTI, but we know in male patients, urethritis is more prevalent. So a provider will likely consider STI testing via a PCR test to check for chlamydia and gonorrhea at minimum. But why didn't Mike choose urgent care in the first place? Pretty simple. He doesn't have an established PCP. And this isn't an uncommon issue. More than 100 million people in the US don't have a primary care provider. So this patient needed immediate access to a healthcare service, and the urgent care clinic he walked into helped fill the access gap he needed. Finally, we're going to take a look at Diane. Diane, she's a 38-year-old female complaining of a week of malodorous vaginal discharge. She is in a monogamous marriage. She reports that she's concerned she may have an STI. Unfortunately for Diane, her next available OB/GYN appointment is 6 weeks away, and she also desired to have care from a provider she didn't have a long-standing relationship with due to her concerns about potentially having an STI. For Diane, diagnostic testing could start as targeted initially, which could include a wet mount to look for trichomonas, BV, and yeast, since vaginitis would certainly be on the differential for her. And this could be done as a point-of-care test as well. PCR testing for gonorrhea and chlamydia and trichomonas would likely be used as well. Serology testing for HIV and syphilis could be used if the provider determines she's high risk or if there's been an exposure. But since she's early on in her symptoms, she may need to repeat serology 6 to 8 weeks later anyway. But let's look into why did Diane come to urgent care over her OB/GYN, over her PCP. There was a long wait time to get seen by her OB/GYN, and that's in alignment with the 19% increase in wait times for OB/GYN appointments since 2017 that Dr. Goldberg pointed out. She also said that she desired more privacy with her sexual health concern, especially if this is her first time seeking STI testing. So the urgent care setting gave her a perception of increased discretion. So what do all these patients have in common? Speed matters. Urgent cares offer convenience, accessibility, as they often offer walk-in services, they have extended hours. If a patient is experiencing symptoms of an STI, an urgent care provider could give quicker results or guidance compared to waiting for an appointment with their primary care providers. And then there's the fact that not everyone has a regular PCP or women's health provider, so urgent care can be faster and fill that gap. In summary, I mean, each patient's reasons for seeking urgent care for STI testing, it depends on personal circumstances, convenience, comfort level with healthcare providers. But at the end of the day, speed of diagnosis and speed of treatment is very important for both urgent care providers, clinicians, staff, and the patient themselves.
Great job, Allie. Thank you so much. I have a couple of questions that came up. Allie, Dr. G, making that connection and building that trust with these patients who are worried for a lot of reasons, right? It isn't just their health. There may be a partner involved. There may be that embarrassment that's involved. They're at a very fragile time. What are some of the tips, tricks, ideas based on your experience in dealing with these patients to put them at ease? Because I think that's really the hardest part is building their confidence, getting their trust that, hey, it's going to be okay. We're going to help you get there. Allie, Dr. G, what's your experience?
I deal with this a lot because I primarily work with adolescent and young adults who present to urgent care. And it's a lot of times it's their first time seeking care for a reproductive complaint or STI testing in general. So I try to normalize the experience as much as possible and emphasize that STI testing is a routine part of your healthcare. I think people get really anxious too, and they're worried this information is going to get out some way. And I always try to highlight that confidentiality and say something like, your health information is private, and the results of the test are only shared with you unless you choose otherwise. And I think the biggest thing for me is avoiding shaming and judging language. So, because that can help build trust. Phrases like, it's common, many people experience this, it's okay to talk about these things, help normalize the conversation. And I think that goes a long way.
Ben, I think a lot about shared decision making. First, I want to build rapport. I want them to know I'm here for you and I'm listening. 4 key steps I think about: information. Are we aligned on what's going on in terms of the disease process, its present and future impact, what other considerations we need to think about, such as partner testing, right? So get aligned with that. The second is we want to understand their preferences for information, for reporting that information, or other. So that's also very important. If I have some decision aids, I like to pull on those. So this is what chlamydia is, gonorrhea is, trichomonas is, HIV is. And then finally, we come to shared decision-making on next steps, right? We confirm, are we aligned on all the before elements, our understanding, our options, and are we agreeing? And I find those steps lead to a most productive encounter.
Great feedback. Thank you. Alan, I love your perspective, having 20 years experience in urgent care. And you've seen as urgent care came out of its infancy and developed, and originally you didn't have benchmarks. And now you have great benchmarking data to kind of manage a practice by and figure out where to go and direct those decisions. Let's talk about the profitability and some of those benchmarks that you had. You were showing those top 5, 10% of practices. We're seeing those, 1 to 3 patients a day of STIs. What are those practices doing to attract those patients into the door and not scare away their other patients potentially? Or is that something that practices talk about?
I would really look to digital marketing. We've identified that there is a patient healthcare journey that when something arises, when patients have questions, one of the first places they turn to is their phone. And so it's relatively easy for an urgent care center to add STI testing to their website. Google Places is increasingly important to make sure that in your digital public-facing communication that you list all of your services, including detail about your STI testing, and the more high quality content, the more value that would get for your search engine optimization. I would even say some paid search may make some sense, search engine marketing, buying keywords in your specific area. By using a digital channel, it reaches those who are specifically looking for this information without rebranding your facility as, say, something else. So I would say that would be the lowest hanging fruit. I would say within the clinic, there's opportunity for communication as well, just for other patients to say put posters in exam rooms listing all of your services. And I would be nonchalant about this. We treat sprains and strains. We treat upper respiratory, we treat STIs, just included in the list. So people see that and they'll know that this is something that they can come to the clinic for. And then the last point I would make is that I have seen very successful advertising to higher risk populations. In fact, that's one of the few advertising channels in urgent care that I've actually been able to attach an ROI. So the challenge with advertising in urgent care, unlike say the Mexican restaurants sending out coupons and they can track how many coupons come back and how much food they sold from that, urgent care can get the message out there. People can receive it. People can intend to use the urgent care. They've just not had an urgent care need. But if you go into to, say, advertise on a college campus where you have a high-risk population, or identifying other at-risk populations, groups who epidemiologically show higher incidence of STIs, targeting those groups specifically, then you can actually track an ROI. You place
Right.
the ad on the college campus, and then how many people came in from that. So I think there are a number of ways through marketing to get the message out there, to reach those who need the message without rebranding or turning off your regular patients.
Yeah, and you already have the CDC and the local public health services already promoting the need for more STI testing. So it's about inserting yourself into that conversation and making it part of your broader overall offering. Which
Yes,
I
let
think
other
that,
people do your lifting. So, like the
yeah,
example of the billboard ads that I showed, STI testing, that sets the message. But when the patient goes to look on their phone, where can I get this near me? And so you definitely want to be there when the patients go looking for it.
right. Ride the wave, right? We got a silver tsunami coming. Let's get ahead of that so we can ride the wave in. Ali, you did a great job of talking about the different testing options that are available. We had a question from the audience specific to health tracks. What testing options do they offer, and how are their testing options different?
Great question. We offer next morning PCR testing for your head to toe everyday infections, and that includes common STIs like gonorrhea, chlamydia, trichomonas, HSV, and less common but serious infections like your mycoplasma genitalium, ureaplasma, extragenital testing for if you're concerned for rectal or pharyngeal involvement, and then sexually associated conditions like BV and yeast as well.
Excellent. Very good. Dr. Goldberg, patient satisfaction perspective, clinical perspective, speed to diagnosis is everything in these patients. That's what Alan's data clearly showed around patient satisfactions. People want a quick answer. Are there correlations between speed to diagnosis and treatment and improving outcomes with these types of patients?
What we know for sure is that speed is associated with a couple things. Speed is associated with clinicians feeling more empowered. Speed is associated with physicians feeling that they can be more judicious in their treatment choices, either offering a shorter course of an antibiotic until they get the information back, or waiting until they actually get a report with a particular pathogen description. And we've contributed to some peer review literature that has demonstrated that. So the speed matters. Further, with molecular testing, there is evidence that by getting the diagnosis right early, you achieve a couple things. When you look downstream at the subsequent course of episodes, the total cost goes down and the total number of visits goes down. And the inference there is that you're getting the diagnosis right the first time, you're getting the treatment right the first time. And so therefore, there's not the need for the subsequent visits.
Excellent. Alan, you made a compelling case around the financial part of getting into this business. From an operational perspective, you talked about some of the challenges. What's the number one thing that you're talking to a lot of practices out there, a lot of urgent cares, that they say, this is why I don't do it? And why should they, what should they do to overcome that? What one thing that you think is holding people back from treating these types of patients?
Apart from understanding your reimbursement, whether that is through insurance or your cash pay pricing, once you get past the revenue questions, it really comes down to throughput. And as I mentioned, that because urgent care is a volume-driven business, the way that you drive volume is through speed. And a provider can see 4 patients an hour, and you can fill those 4 patients per hour. One patient every 15 minutes with say very quick upper respiratory type cases, then somebody might look at this and say, well, things that disrupt throughput or things that take longer, whether it's an exam related to STI testing, or if it's a suturing a wound, that can take a little while longer. We are looking at on average, over the course of a day, in terms of our throughput time. I would say to staff training, having clear protocols in place and practicing solid urgent care medicine. So not being a clinician, I would say it definitely starts with a top down that the medical director, the chief medical officer, the physician entrepreneur, whatever the structure, whoever that medical authority is driving your practice, that they are fully on board, that they've defined the protocols around treating the patients, and that you devise processes to treat these patients efficiently. Nothing in urgent care. Urgent care has a very strong 80-20 rule. 80% of the patients are around the top 20 diagnoses. So everything in urgent care should be repetitive. You don't have to reinvent the wheel for every patient. And I would say with that, that's avoided through strong training and strong documentation of your operating procedures.
Fantastic. Thank you, Alan. Thank you, Dr. Goldberg. And thank you, Ali, for a great conversation and some really insightful things from a clinical, financial, and operating perspective. A couple closing thoughts. One is the high prevalence of STIs today and the growing demand is really, the silver tsunami is kind of one of those terms that's just stuck in my head. So I think this really kind of creates an overall impact across all demographics. It's not any one patient type. It's everybody you see walking into your clinic today has a high probability at some point needing STI testing. So you're already treating these patients. They may not just be coming to you, which I think is kind of a new way to think about it, to Alan's point. The long risk health consequences to STIs, if you're a young lady or gentleman looking to start a family, if you don't get taken care of sooner rather than later, this could be a life-altering event. And the success of treating it and getting that treatment is profound. The opportunity for urgent care, Alan, when you laid out those statistics around half the practices not doing this testing, that was shocking. And then to see that the best practices are doing it, success is simple. Find what works and consistently reproduce it. And this is something that just kind of jumps out there, is that if I'm not in this business, I'm fighting with one hand behind my back. And then Ali, I thought just a great job on the operational efficiencies, what testing to use, and then how to deal with these patients. Because really, it's about getting patients healthier faster. That's what they care about. Every clinician I know, that's what they care most about. With that, we'll conclude today's webinar. Thank everyone for participating today.